So, what's up, Facebook? I am Joe Gellatly.
And I'm Amanda Hepper.
This is Medcurity Live.
We're the co-founders of Medcurity, which is the HIPAA Tools and Resources platform. And we're located in Spokane, Washington, and it is a beautiful day here.
This is our first episode, if you couldn't guess, by us figuring this out as we go. But we will be broadcasting weekly here on Facebook and eventually on LinkedIn as well, talking about, of course, some HIPAA compliance topics as well as what else is going on in healthcare. And we have some great guests lined up that will join us as well. So adjust your social media policies accordingly and make sure you can be live on Facebook and catch us here on Wednesdays. Today we want to talk about a few of the focus areas for HIPAA, especially 5 that we've talked about highlighting from the perspective of what's been a hot topic right now federally.
So the first area we'd like to talk about is business associate management. And business associates are basically the vendors to covered entities to clinics and hospitals that provide patient care. So it's really important that you understand who your vendors are that touch your protected health information. So you need to have business associate agreements in place that outline what the responsibilities are of your business associates or your vendors. 20% of the OCR fines approximately are related to business associates or the lack of having a business associate agreement with your vendors. So it is said that you're only as safe as your partners are. So that's one reason why it's really important to track that, to know how often you need to renew your business associate agreements with your vendors. You can do due diligence surveys, send those out to your vendors so that they know that you're keeping track of what they need to do to protect your information.
And the requirements for these agreements have changed, right, over the years.
Yes.
So they get outdated at a certain interval. And is there a certain amount of time that they should review them, or it's basically up to the clinic?
It's up to the clinic, but some people do it every year or every 3 years. The really important part is to renew those agreements when you say you're going to renew them, right? So if you say that you're going to do that every year or review them and then you don't do it, in the event of a breach, if you're not doing what you say you're going to do, then you get your penalty could be increased. Yeah.
And in case you haven't heard this before, the penalties can range from about $100 from $100 per medical record exposed to $50,000 per medical record exposed. Mm-hmm. So these things we wanted to highlight or focus are areas that may increase that penalty because you're not showing that you had systematically and systemically put in precautions and policies to protect yourself. The next area that we talk a lot about is device encryption, laptop encryption, which has been repeatedly another headline creating issue. There was a group in Texas that got a multi-million-dollar fine because they left a laptop in the back seat of a car. It got stolen. And I was thinking about this last night because I was sitting next to somebody who misplaced their phone. And for me, I get panicky even when it's somebody else's phone. Like, I can completely understand when they're looking at their purse and they're looking under the table and under the chair. And I start to get kind of anxious too because I'm going, oh man, I hate that feeling. If it's an unencrypted laptop with patient information, that is like 1,000 times worse because that becomes a massive breach, becomes a PR nightmare. So whether it's BitLocker or if you're using a Microsoft Windows Professional and you can use the built-in encryption, encrypt those devices. We get more and more mobile devices out there in these clinics and hospitals, and it's just becoming a very important thing to ensure that nothing can leave the door that could possibly be accessed without having those encryption keys.
So the next area we'd like to talk about is access controls. And part of that are in regards to your facility, to your clinic, to your practice, the physical layout of your practice. So you need to keep track on who is entering your facility. Sometimes we can get desensitized to people that we know, and they may just walk by the front reception area into the office. Maybe they're a pharmaceutical salesperson or whatever, so you're very familiar with them. However, which I understand, but you need to track the entry and the exit of those of people that come into your facility. Patients should log in, you should check them in. Everybody besides that, there should be a login sheet or something like that. And you should understand who they are coming in to see, so that if there is a potential breach, you know who was in your facility, who might have caused it, and that type of thing. Also, in regards to facility access, highly recommend it. You need to know who has keys to your facility, who has access codes to server rooms, to different areas of your facility, and you need to monitor that. So know which employees have access to what. That will also help you when they move on, so that you can make sure that you get that key check back in, change security locks, and that type of thing. So another type of access controls are access to systems. Who should have access to what type of software, electronic systems in your practice? To keep an inventory of your systems, who has access, we suggest, and it is really mandatory, to have role-based security. So clinicians, of course, are going to have access to clinical data, and then maybe the front check-in receptionists do not need to have that type of access. So to have that role-based security, assign roles to people according to the systems that they have access to. That also helps you when somebody is promoted maybe to a different kind of position, you change their access, or when they leave, you know what access to turn off. So if you have that very detailed, it makes it much easier to keep track of that. Another thing to do is to have an auditing program. So periodically, document how you want to periodically check your systems and who is accessing charts, whatever, and then document that you have checked that. Keep those logs, very important.
Yeah, we saw the recent breach where it was a Google Calendar, which really brought to light that we're storing information in more places than ever. And so you may think, okay, the EHR access, obviously, let's make sure we shut that off and we terminate someone or we control that access. But there's more and more tools being used, and so to keep a great inventory of what systems you have, who has access, and ensuring that you can really shut that all off when somebody leaves. It's big. So hey, we got some people watching. If you would take a second, like we said, first show, throw a comment in there, tell us you're watching. It's great to have the support and have you online. We're going to answer questions anytime, but even if you don't have a question, just say hi, because it's fun to have some people joining us live. We have number 4 of the 5 items that we want to cover is doing that risk assessment. And the feds actually said 90% of the time they come in with a significant penalty. The hospital or clinic failed to complete a recent risk assessment. So this is your security, HIPAA compliance, and the guidance from CMS is about an annual basis at least, or if you make a significant change, like a new system or new building, new facility. So going through that extensive audit is a very important, critical piece of staying compliant. And so that's one of the things with Medcurity that we focused on. That was the first big piece we took on, is how do we break out of this spreadsheet process and have a nice tool that guides you and gives you definitions and explanations as you go through that assessment.
And is it important to get a baseline?
Yeah, that first gap analysis to begin to just see where are we at today. And nobody's perfect. We're all, no matter if you have a large compliance department or if you wear 13 hats and one of those is a compliance officer, we're all growing, and there's this maturity cycle that we're on as far as HIPAA compliance goes. So yeah, figuring out where you are and having a good plan to move forward. Christina, thank you. She says we look great. Yeah, so that's the assessment, and it's not specifically required to be annual within the HIPAA guidelines, but we're looking at that as annual is best practice for sure, and CMS is looking for annual as well.
So then what? You do your security risk assessment, and then you will identify areas for improvement, right? So you can call them deficiencies or issues, and then develop a mitigation plan to address those. And when you do that, it doesn't mean that you have to do every single thing that year, but you do need to prioritize those items, right? See what's most important to your organization, document that, make assignments for who would be taking those actions, and then monitoring completion of that. So actually, that's one thing that Medcurity also does. We provide recommended remedial actions because it can be onerous to understand what's next, right? And with that plan, you can make assignments for a year. It's important to show progress year over year. Just like with the risk assessment, you'll show that you are becoming more mature with your HIPAA compliance program. Same thing with your mitigation plan. That will adjust over the year. Are you ever 100% there?
I am. No, nobody is. You never are.
Right.
Right, so it's a journey.